impacted drug users, we know, has been pretty profound in terms of we know more people are under distress, which usually raises people's use, and people's access to different kind of support services that they would normally use to take care of themselves are also not as available. Also, the drug supply, we know, in San Francisco is really inconsistent because of different changes in terms of shipping routes and other border closures. So with an inconsistent drug supply, with people sheltering at home, with people not being out and socializing, we know that overdose has been going up. We know through anecdotal reports and through some of the data we're able to see through Narcan distribution that there have been approximately 3 times as many people who have died from overdose in San Francisco during the time of COVID than have from COVID itself.
Once the shelter in place started here in San Francisco, we essentially had to redesign our entire program. We moved syringe access from the 6th floor down to the 1st floor at street level and had to adhere to best practices during COVID. Now that we're at the street level, we're able to access more people. We've had a lot of clients come who tell us, I didn't even know that Glide had syringe access. We not only see more people, we see a more diverse clientele, and we're able to support clients that have been accessing Glide for a long time in different ways than
that we're trying to improve with our harm reduction services is making sure that we're capturing everybody who uses, including people who use by means other than injection, which has been the traditional model of harm reduction as it emergently evolved to stop the spread of HIV and hepatitis C. So we know now that drug smokers do exist and that they have needs too. And in fact, they're often of a different demographic than people who choose to inject. So we want harm reduction to be for everybody, about giving anyone an opportunity to improve their lives and their well-being without excluding anyone because of how they choose to use.